Good morning, friends. Dr. Pierre here. In the last video, I gave you 5 tools to help you successfully treat your opioid addiction. And like I promised in that video, I'm following up right now to show you how easy it is to find a doctor or professional to help prescribe you those tools and other resources you can use to get help like right now. As soon as you're done watching this video or while you're watching this video, you can get help. Okay, so I am going to start with just watching my mouse on the screen. And the first, probably the most important site I would recommend is SAMHSA. It's the Substance Abuse and Mental Health Service Administration. It's a government website in the United States. And this is the front page that you go to, or the home page. And it has several items for you to find help. So you can either go here under the Find Help and Treatment. It has suicide hotlines, a national helpline, and off to the right over here, there's behavioral health treatment services locator, buprenorphine locator, opioid treatment program directory. So let's pick one of these and see what we get. So let's start with behavioral health treatment program. So it takes you to this page where there's a locator, and you can easily just place your zip code. I'm placing my office zip code, hitting enter, and look at this. Look at all these treatment centers just in this zip code alone, and there's what, 7 pages of different treatment centers, and we're looking at, I think it's showing 100 different centers per page. And this is in Oklahoma, and this is, I'm not sure if you're familiar with Oklahoma. It's not that populated, and yet here are all your different options here. I would absolutely start here. I think this is a great, valuable resource. And wow, I don't know what I just did there, but it's showing you the at least the eastern part of the state down to the Dallas-Fort Worth area. Okay, well, let's go back to the previous page and go back a little further. So the next option we have are for the buprenorphine physician locators, and this is for doctors who have their certifications to prescribe Suboxone, buprenorphine, and any of those forms for opioid addiction. So it takes you to this page. Again, you can type in the zip code, hit enter, and you should start seeing a list of certified doctors. Again, this is in Tulsa where I practice. And again, this whole list of people here. Now, of course, you have to make that phone call. Some of these doctors will accept insurance, some of them won't. Some of these doctors will be full. You have to understand that the first year doctors certified, they can only see 30 patients. The second year is only 100. And if they become board certified, they can see 275 starting their third year if they meet some of the guidelines. Now, it's not just doctors. There's nurse practitioners who and physician assistants who can now get certified. But the one thing I want to stress is that you want to make sure, if you have the option, that you pick a board certified doctor to treat you. Because remember, these are tools. That's what I mentioned last time. And the more tools you can get, the easier it is for you to overcome your addiction. And a board certified doctor knows not only tools for opioid addiction, but maybe you are smoking marijuana on top of the opioids, or methamphetamine, or cocaine, or alcohol. It's common that one addiction is associated with a different addiction, and a board certified addiction medicine specialist is well equipped to provide you that help. Okay, so let's go to another site here. Actually, we can go back to where we started, and I believe there was an opioid treatment program directory here. We'll pick Oklahoma again. And again, here it is. Several different options you have here. All right. The one last thing I want to show you at the SAMHSA website is they have this download here. So let's say you want to go to a treatment center. I really like this because they give you some help in determining how you can select a place for your treatment. And very easy, it's free. It tells you should get one that's accredited, that provides medications, that's evidence-based practice. I mean, almost common sense in the medical profession. But for someone who's scared, who's new, and you're going to spend a lot of money on these locations, it's good to have some guidance, and it's provided for free at this website. All right. I think we may have gotten everything we could at that website. The next one I want to turn your attention to is the Suboxone website. So in case you want to know how I got here, just type in Suboxone.com, and when you hit enter, it takes you to this home page. And they did a very good job here because immediately right there you can punch in your zip code, hit enter. Yeah, whatever. And lo and behold, there you are. It shows you all of the providers within the zip code. Somehow I ended up here at number one, but of course, this has nothing to do with popularity or quality. It's just a list of doctors there. Okay, so let's go to the next option. In my other video, I talked about another drug called Vivitrol, which is the extended release naltrexone. And again, this is nicely put together. You type in your zip code and you hit enter. And here it is. It's going to load up all the doctors within this area. I'm not sure why it's not showing anything here. Because I know I'm one of the providers here myself. So let's type in prescriber and type in the zip code again. Let's see. Aha, there I am. Okay, I thought so. But yes, there's two listed here. I know there are many more. Um, you know, almost any doctor can provide Vivitrol. I mean, maybe not a pathologist or radiologist, but all the medical professionals should have the qualifications to prescribe this once a month shot. So just because they're not listed on this site doesn't mean that there aren't other providers. Okay. The other site that I really like, this is called Treatmentmatch.org. I get a lot of patients from this website. And here's the nice thing about it. You click over here, it says you're looking for a treatment. You have to register. But the good thing about registration, you don't have to give your name. You literally just an ID number, password, and you log on. You provide a description of yourself, what sort of help you're looking for, and this website acts as a portal where a middle person, and it will send your information to several doctors. In fact, the doctors get an alert that a patient is looking for a doctor. It's whatever information you provide. So you provide as much as you want, as little as you want. The one thing I've never seen a patient's name. Now, as the physician, I will review the information, and I usually send an email with my website and just encouragement to have that patient follow up with me. All right. And again, this is free. The next site is Narcotics Anonymous. And man, when I got into doing clinical addiction medicine, I was unaware how vast this network of locations are. So let me give you an example. So again, I'm going to punch in my office zip code 74136, and let's see what we get. Look at this. I mean, within just 5 miles, there's 21 locations, 21 facilities, from churches to secular organizations providing Narcotic Anonymous meetings. Now, again, this is what I told you in the previous video. This is the 12-step program. This works great for some people, doesn't work for others. But again, remember, it's a tool. I'm not exactly sure if there's a cure for opioid addiction, but with tools, you can be sober for the rest of your life. And so why not look into a tool that can potentially provide you the success that you need? All right, the last one I want to talk to you about is Clinidine. And this is the blood pressure medicine I mentioned that you could use if money is a big concern. Clinidine costs $4 for the month at Walmart, and I think if you get 3 pills per day, it's $9 for the month. This will help you if you are detoxing or withdrawing from opioids. I know when I was back treating heroin addicts in Baltimore back in 1999, Clonidine was actually a street drug. I mean, it was traded back and forth between addicts to help them alleviate the pain from an opioid withdrawal. Now, any licensed doctor, nurse practitioner, physician assistant can prescribe Clonidine. At least they should be able to. And of course, the trouble you may have is the justification for the Clonidine. And there are some professionals who don't react kindly to someone admitting that they have an opioid addiction. So you may have to pick who you choose to mention your addiction to. You know, I would love a world where you can tell anybody. I mean, it'd be a great thing to be at a picnic with your family members and say, oh, I have diabetes. Oh, I have hypertension. Oh, I have an opioid addiction. Everybody's like, okay, well, and we move on. Unfortunately, it's not like that. So again, any doctor, primary care doctor, can provide this. You just have to ask. You can get this on the streets, I think, but it's really important because of the blood pressure effects that that you have a licensed professional provide that for you. Okay, the next one. Let me skip over to this one over here, and that's methadone. So methadone's another tool. It has a very long track record, and probably the easiest way to find a methadone clinic is you type in methadone clinics near me, and Google will list a bunch of different clinic options for you, hopefully. And some cities have more, some cities have less, unfortunately. Again, you don't have to use methadone. It's just another tool. Remember what I said earlier? We don't know if there's a cure for this. I mentioned that in my other videos. So instead, look at these as tools to help you to go from, addicted, dysfunctional, maybe breaking the law, to a person who is functional and law abiding. And hopefully a person who's gets to a point, maybe months or years down the line, where you don't need any tools. You just go about your life. That would be the greatest achievement that your doctor or you or together you can both achieve. So let's go to the last one. And I've talked to you in some other videos and mentioned how it's important that you seek a doctor who is board certified in addiction medicine. Now, you don't have to do this. In some places, you won't have the opportunity to. But if you have a choice, the advantage of these physicians is that they're trained not only to hand you a Suboxone pill or a Vivitrol shot, is they have to learn every type of addiction. Most individuals will come to my office. They have a heroin addiction with a cocaine addiction, or they have a benzodiazepine addiction with an alcohol addiction. And some of them, I think one of my toughest patients had 14 different drugs in her system. And within 3 months, we got her down to just 2 drugs. And she continues to make progress. And a lot of that information and the knowledge that I gained was really studying for my boards so I can be board certified through this organization here. So how do you find a board certified doctor? It's pretty simple. You go here, you do a physician lookup. You can do it by state. And in my state of Oklahoma, hit a search. And I forgot, you put addiction medicine, hit a search, and here are the doctors who have that board. I'm not shocked that it's this few, but again, there are enough in this state of Oklahoma. And let's pick a more populated state, as in Texas. We do a search here. Again, a whole list of doctors, all board certified in addiction medicine. I mean, lots of valuable resources. Well, I hope that you found this video helpful. If you did, please give me a thumbs up. And if you did find it helpful, I know you'll find my website a valuable resource too. It's frugaldoctor.com, where I upload videos and information. And again, all of this information I'm providing is completely free. Thank you for watching the video.